Hi everyone, I would like to welcome all of you to join this special program. Before the lecture, I'd like to introduce myself to you. My name is Kim Yong-seok, as a professor of Department of Acupuncture and Moxibustion Medicine in Kyunghee University as a chief professor. And I work for World Federation of Acupuncture and Moxibustion Society as a vice president and the co-chair of standardization committee. And I work for WHO, the Family International Classification at the Traditional Medicine Reference Group as the voting member, and International Organization of Standardization, the Technical Committee, the 249, the head of delegate of Korean delegations. Well, it's my pleasure to introduce health technology of Korean medicine and share some thought to you. As you know, the traditional medicine is Western medicine were developed through the different culture and different background, different philosophies. They look at health and disease and its cause is in different way, different method, different approaches. These pictures show that many patients are using complementary and alternative medicine and asked to the doctor, what about herbal medicine? What about acupressure? What about acupuncture? Unfortunately, most medical doctors do not know sufficiently the CAM. Therefore, medical doctor cannot appropriate the guidance and advice about the CAM for patient. It is the starting point and main aim to research for CAM. And now is moving forward to integrative medicine. For example, the name of the traditional medicine department in charge of WHO headquarters has been changed from traditional medicine into traditional complementary and integrative medicine. According to the survey of United States adults, the conventional medicine was perceived to be more effective in treating high blood pressure and lung condition and digestive system conditions. And the CAM is more effective in treating certain conditions such as the back condition, back problem, back pain, and allergy, fatigue, and arthritis, headache, and neck condition, strain, and sprain. Today, I'd like to introduce the health technology of Korean medicine in two parts. Part 1 is the diagnostic technology, include the pulse analyzer and 양도락, the 요도락, and the tongue image analyzer and HRV. And the second one is the therapeutic technology, including acupuncture and moxibustion and herbal medicine and tuna therapy and thread embedding acupuncture and cupping therapies. The diagnostic method of Korean medicine are 4 categories. As you can see, the first one, inspection, is just looking, and auscultation is listening, and history taking is inquire or asking, and the pulsation and palpation and percussion. According to these 4, the diagnostic method, and doctor could find the 8 patterns of disease. That means yin and yang, and interior and exterior, and deficiency and excess, and cold and heat. Interior and exterior means the location of disharmony and problem is not the cause. The deficiency and excess indicates the strength between vital key and evil key. To put it simply, they evaluate the natural healing power. And cold and heat describe the nature of a pattern or disease and clinical manifestations, usually in combination with the deficiency and excess. And yin and yang are the general category of the other 6 patterns. So example, interior, deficiency, and cold are categorized into the yin, and exterior and excess and heat are yang. The Pearl's diagnosis is one of the 4 major assessment examination in Korean medicine consulting. And Korean medical doctor is used to combine the clinical data collected from the pulse assessment and other clinical assessment in order to prescribe the treatment to his patient and monitor his prognosis. Pulse itself is objective, but pulse condition is subject. There's some problems. And description of pulse are subject to interpretation of individual doctor. And this lack of quantitative standardization undoubtedly contribute to low inter or intra-later reliability among Korean medical doctors. In order to quantify the pulse diagnosis and scientifically establish the waveform of the pulse according to the disease, and research on electronic pulse generator has been attempted since the early 1970s. But until now, a Korean project leader contributed to the publication of international standardization, ISO 18615. The title is General Requirement of Electric Radial Pulse Tonometric Device, was published. The pulse is differentiated in terms of the depth and speed and strength and shape and rhythm. And different condition of the pulse indicate that means different syndromes. This one is Yangdo-rak. In the Japanese, the pronunciation is Yodo-rak. It's known for the 40 years. It was developed in Japan by the doctor and the professor Nakatani. It is a method of electropuncture diagnosing of the functional condition of the meridian based on measurement of the electroconductivity, its electrical resistance in the representative point of meridian, so-called acupuncture point. The result are placed on the special form, Yodo-rak analysis chart, and deviation from the average of the Yodo-rak line can be easily read from the analysis table, just like this. And the basis for the making a diagnosis is the following information: value of deviation of individual result. Second one, the direction of the deviation, and above or below the physiological line, and relationship between the individual result, and finally the difference between the left and right side of the body. Next is a tongue image analysis. The tongue has many relationships with the body and meridian, so it is very useful and important during the inspection for confirming Korean medicine diagnosis. It can present the strong visual indicator of a person's overall harmony or disharmony in order to quantify the tongue diagnosis. Also, international standardization was conducted by Korean project team. So ISO 20498, the title is General Requirements for Computerized Tongue Image Analysis System, Part 1 is a general requirement, was published in 2018 by the Korean project team. This one is heart rate variability. It's a simply measure of the variation in time between each heartbeat. This variation is controlled by the primitive part of nervous system, called the autonomic nervous systems, ANS system. HRV is the most effective way of estimating ANS balance between parasympathetic and sympathetic branches. If a system is in more of the fight or flight mode, the variation between the subsequent heartbeat is low. But if one is in more relaxed state, the variation between the beats is high. It is similar to the yin and yang theory in Korean medicine. Now I'd like to introduce the treatment technology of the Korean medicine. There are 4 basic treatment technologies, such as acupuncture, moxibustion, and the traditional physiology therapy, and herbal medicine. The main purpose is the equilibration state. As you can see, the Korean medicine is first one is a 도인안교, is a traditional physiotherapy. And acupuncture and moxibustion is a heat stimulation. This one is a mechanical stimulation. And herbal medicine and the suction cupping is popular in the treatment modality in Korean medicine. 도인안교 is a traditional physiotherapy. The finger pressure, acupressure, massage, and Tina or Chuna is similar to the chiropractic in the United States and the osteopathy. Acupuncture is classically is 9 kinds of the acupuncture needle is according to the shape and target the diseases. Now is usually piliform acupuncture needle is popular. And the modernized acupuncture technique and stimulation is the electroacupuncture, laser beam, heat, needle, iontoporosis, and magnetic applications. And now is a microsystem acupuncture use, the auricular, scalp, hand, foot, eye, facial, nose is the microsystem acupuncture. That's the background is the whole one theory is a kind of the holism. It's similar to the reflexology in Western countries, the foot or one hand. And moxibustion is the kind of the heat stimulation method. And this one is the moxaculture is the indirect or direct. Sometimes it use the moxa stick is kind of the heat elimination. And the moxa pipe and non-moxa cauterizer is electric heater is used, is modernized techniques. And acupuncture and the moxibustion combined is the warm acupuncture. The first acupuncture, on the acupuncture point, and the tip of the needle you apply the moxa is the burning, is the mechanical stimulation and thermal stimulation combined. The next one is the herbal medicine. It's a kind of the phytotherapy is like the Western medicine. It's with oral medication. sometimes is external, it's like ointment. And topical, the application, ointment and just the plaster you can use to make a blistering. And combine acupuncture and herbal medicine is one of the loci injection. And acupuncture, herbal puncture, pharmacopuncture is a similar term. And now needle thread embedding, subcutaneous needle is a dermal needle, and the something needle is one of the technique of the acupuncture. And next one is the suction cupping. The two kind of method is the flame, and sometimes is the bloodletting, is like the venesection, and dry cup, and wet cup, and flame cup is the three kind of the method. The suction cupping. We can use the bloodletting, we can use the 3-edge needles. And the combined two herbal medicine and the suction cupping is a suction with the herbal juice. This one is the Korean medicines, the treatment modalities in overview. The acupuncture is very popular, but the term is very important things. Acupuncture is defined as intervention modalities that is stimulated the specific acupuncture point and using needle and with the various manipulation to achieve the balance key and blood, which is the known as the natural healing power. It's the equilibrium and the balancing the disharmony by the acupuncture. One is the acupuncture point and appropriate stimulation. According to the Hwangjae Naegyong, is a Chinese classic book in medicine, written 2 or 3 centuries BC. Acupuncture started in the eastern and the southern region, and the moxibustion in the northern regions. The point of the reference for geographical direction here was the Chinese continent. Since the eastern region is usually inshore, there are a lot of fish rich in salt. They enjoyed by the fish and salt. So the disease like boil and other related diseases were prevalent in this region. And acupuncture is very proper method, the treatment for them. But is for the northern part is a cold and windy zone. So there are many diseases caused by the cold weathers and chilling the wind. So in that cases, moxibustion is heat stimulation is very useful. The method. So since the Korea, the center is a Chinese continent, as it's a geographical references. The eastern part, the Korea is called the east of the sea, or the eastern country in olden ages from the view of the Chinese. So eastern region here probably report to in Korea. So many the doctors and many the researchers, this Korea is regarded some as the country where the acupuncture was born. The basic theory of acupuncture and the moxibustion is represented by the theory of yin and yang and 5 elemental theory. It's difficult to understand Western cultures, but Eastern culture is very popular, and the concept is popular and well known about that. This slide shows the cyclic flow of qi in the 12 meridians. This meridian start is the lung, and final is the liver, is a circle. Its meridian flow direction is the surface and surfacing point and the pairing system between the internal organ and the body surface. The yang meridian is a yang meridian. Usually, they circulate the posterior and lateral side. And yin meridian is circulate anterior and medial side of the bodies. In order to obtain the best result, the acupuncture practitioner must pay careful attention to the following the requirements. First one is accurate diagnosis. Second one is the selection of most effective acupuncture point and accurate localization of the acupuncture point. And third one, for the use of the current technique of insertion and manipulation is a stimulation and use of the good quality acupuncture needle. Acupuncture is produced is like the side in the clinical and the field. First one is the material is the acupuncture needles, the instrument, and the patient position, and point selection, and needling method is a stimulation method, and treatment session, and the possible accident and adverse effects on some problems by acupuncture practice. Acupuncture needle is made of the stainless steel. It is preferable to use disposable the acupuncture needle. The acupuncture needle is most commonly used in the 40 millimeter in length and the 0.25 the millimeter in diameter. There is an international standard also, the ISO 17218. They specify the requirement for a sterilized the acupuncture needle for single use, specialized for piliform needles. The patient body position is during the manipulation and acupuncture shall be appropriate for practitioner to select the acupuncture point and perform the manipulation. The right position, the patient should feel comfortable when the practitioner retain and manipulate the acupuncture needles. The commonly the chosen by convention is a lying position. A lying position, right? The sitting position is popular and comfortable to practitioner and the patient. And the spine position, this one, the spine position is suitable for acupuncture point in the chest and abdomen. And prone position is suitable for acupuncture point on the low back. So with low back pain, in that case, is the prone position used. This one is very important thing is acupuncture, point selection. The reason why the acupuncture is the point specific treatment modality. So acupuncture point is very important. So the selection of acupuncture, how can we do? The acupuncture points to be used may be selected. The 1, 2, 3, 4 is 4 categories. First one is the basic, the approach by the meridian theory. This method, therefore, regarded as effective means of the treatment once the external symptom of illness is appeared. For example, the acute low back pain, acute headache, and the external some problems, and then we approach it meridian theories. And the acupuncture point is a local point, is arch point, is tender point, and selected the nearby the acupuncture point, and the remote distant point, according to the meridian theory, is we cover the root problem of disease. This one is a kind of the superficial problems and acute the pain relief. And second the one is approached by the pattern identification, as opposed to the first method approached by the meridian theories. And this one is a selection of acupuncture point according to the traditional theory is essential for matter of precise regulation of the vital energy, vital qi. And central to this method approach is examination of the pulse, and which reveal the imbalance of qi and blood. And third one is approach by the 5-element theories. It's a kind of very popular in Korean acupuncture field. We so-called the Sam acupuncture, which is one of traditional acupuncture technique that has been commonly applied in clinical practice in Korea. And Sam acupuncture theory is based on the 5-element theories and the tonification and the sedation theory of the acupuncture the techniques. The last one is approach by constitution. Based on the theory is the Sasang constitutional medicine is a unique the medical system in Korean medicines. And this one is in all the times, the ancient people thinking about the all kind of disease invade from external and internal. And this one is the surface stages, acupuncture technique, and the point selection is a meridian. This one is external part. And then put into the internal imbalance, and we check the pattern identification and the 5-element theories. And the body problem is not covered. It developed the mental and the psychological problem. In these stages, the constitutional approach is useful for patient. For example, is a headache patient. According to the location, the approach to the pain problems, first one is the location. It's very important thing. The reason why we can choose the remote point. This area is the frontal, is the stomach meridian, and the vertex is liver and gallbladder. The parietal is the small intestine and gallbladder. And this temple is the stomach and large intestine. Occiput area is the blood and gallbladder. So this one is a local point. And this one, pain, in the vertex of top of the head, the pain, we can choose the painful area, ouch point, and the tender point. And then this one is related to the liver. So we can remote the problem, is remote, and acupuncture point is the liver. 3. This one is a root problem. To combine is the meridian approaches. If not cured by this method, and then we can use the 5-element theory is the Sam acupuncture, and it's not cured because the mental problem is the Taeguk acupuncture, is the according to the Sasang constitution method. This one is acupuncture needling. It's the angle and depth and direction along the meridian and against the meridian. The flow are also important in the process of insertion of acupuncture needle. Generally, the angle formed is a perpendicular and oblique and horizontal. The very popular technique is the 9 degrees is the perpendicular method. The angle formed by the needle and the skin can be divided into 3 kinds of this method. And depth is the important thing of the acupuncture needle. The depth of the insertion mostly depends upon the condition of a patient and the location of a point and the pathological condition. For example, the problem is on the muscle, and then we put into the acupuncture needle to the muscle. And bone problem, we can reach to the bone, is a deep stimulation and deep insertion. That means according to the target, the organs, we can the depth of acupuncture needle is controlled. The manipulation is a kind of the stimulation. As you can say, as I mentioned before, the acupuncture is a point specific. Second one is a stimulation specific. And stimulation, very important thing is there are the manipulation techniques to get the acupuncture the effect. The manually flickering and the scratching and twirling and rotating, lifting, thrusting, and shaking and the vibration is a tool to make a stimulation. And nowadays is the other modality is the moxibustion, electroacupuncture, and TENS, cupping, laser, and acupressure, and the ultrasound, something like that. Electroacupuncture is applied to the small electrical pulse on the acupuncture needle put in. And this method is generally for the pain relief. And there are 2 kinds of parameters. First one is a low frequency electroacupuncture to obtain a pain relief, high intensity of stimulation. High intensity means sufficient to produce the muscle contraction is recommended. The high frequency electroacupuncture is used at intensity sufficient to produce a comfortable and degree of tingling. It's not the produce muscle contraction. Low laser, the low energy laser system called the soft laser sometimes applied to acupuncture point. This the indication for laser acupuncture is chronic pain and the skin disease such as the wound healing. Needle sensation or the dicky sensation and the chi sensation is described as a feeling of the soreness and the swelling and heaviness and numbness the experience by the patient as the physician is needling acupuncture point. So we call the chi arrival. Some patient and feel the local sensation, fullness, heaviness, soreness, and the general sensation, relaxation, and drowsiness, the well-being feelings. The PSM, we so-called propagated sensation along the meridian when the meridian points are stimulated by the acupuncture needles. This meridian was mapped out the ancient time by subject measure of the needling sensation according to the superficial flow pathway of the bodies. But it's the property of the ditchy sensation and PSM line and propagation rate and velocity may have a wide range of variabilities from individual to individuals. And next is the treatment session. The needle would be left for the 14 and 20 minutes. It required approximately 10 sessions of treatment and 2 or 5 sessions of treatment for a week. It is usually 3 or 4 times in the 4 sessions where the treatment and the patient is like the response to the acupuncture, the treatment, and often more than these people long, the relief is obtained. Recently, a very interesting research on acupuncture on the pain. The famous research paper has been published by the Korean researcher. As you know, the chronic pain reduces the quality of life, and it is important clinical problem associated with emotional and cognitive dysfunction. Epigenetic the regulation of DNA methylation is involved in the induction of abnormal the behavior and the pathological gene expression. But the Korean researcher examined whether acupuncture can restore epigenetic change caused by the chronic pain and identify the underlying mechanism in neuropathic pain in mice. Their results suggest that the acupuncture can relieve chronic pain-induced comorbid condition by altering DNA methylation in prefrontal cortex. It's very interesting, the research. Low back pain is very popular in acupuncture. According to the systematic review and the meta-analysis, it is concluded that acupuncture should be considered as one of the active treatment modality for chronic low back pain. In 2020s and this year, the Center for the Medicare and Medicaid service in the United States decided to cover acupuncture for chronic low back pain up to 12 visits in 90 days. And this year, in the updated, the NICE guideline in the United Kingdom, acupuncture is recommended as an option for some people with chronic primary pain, provided it is delivered within certain and clearly defined parameters. This slide shows the 24 acupuncture treatment result in statistically significant improvement in salivary flow rate in patients with xerostomia. In the long term, up to 6 months, it suggests that additional appropriate acupuncture treatment can maintain the improvement in the salivary flow rate up to 3 years. The result of study suggested acupuncture, especially ear acupuncture, may be an effective treatment of individual experience intense the level of daily stress and anxieties. In the United States, the military they already use acupuncture to relieve pain and stress for the troops, both on and off the battlefield. And according to the United Kingdom research, acupuncture shown to be an effective treatment for veterans with post-traumatic stress disorder, PTSD. It has been reported that acupuncture application is in obesity treatment is effective in the producing weight loss, and it can affect the appetite and the intestinal motility and metabolism, as well as the emotional factor, such as stress. And acupuncture and the moxibustion has been improved in Korea. There are three unique representative acupuncture. The modality is Sam acupuncture. As I mentioned before, is the 5 elementary, the basis, and constitutional medicine, and Korean hand acupuncture is very popular in the United States and the European countries in the Korean hand acupuncture. Generally speaking, the acupuncture is a safe procedure in the hand of the skilled practitioner. The acupuncture causes little. If any pain or discomfort, in fact, because the needle is so small. But this experience varies with the individual and unique threshold of the sensation, as well as the health condition for which the patient is being treated. Control indication, especially in the acupuncture, electroacupuncture, they use the electricities. So the contraindication is the patient using the pacemaker that disrupt the electrical circuit and passing through the thoracic area, then makes sometimes is the pneumothorax. And the prohibited area near the carotid artery and sinus venosus. And the contraindication is the inhibit the periuterine part of the pregnant woman. And adverse effect the local burn by the electroacupunctures, and sometimes needle cut by the muscle contraction. But nowadays we use the international standard. The acupuncture needle is no problems, and sometimes electrolysis caused by the direct current by the electroacupuncture. Now I little bit stop the lecture, the focus on the acupuncture techniques, and we have the 10 minutes break. We continue. The next is the moxibustion in the other modalities.